Congratulations. Now that your surrogate is pregnant, you have 9 full months of waiting and worrying to look forward to. And that is a long wait. And there's not much to do except be patient and try to stay calm. Step 4, the prenatal care of your surrogate. And after your pregnancy has been confirmed, the surrogate starts her prenatal care. And in the US, that means the surrogate will live at home with her family. Right? She will manage her own pregnancy, and the prenatal care will be provided by her personal obstetrician. If your surrogate is overseas, well, surrogates overseas should also live at home with their families, right? I don't believe in the practice of housing surrogates in a surrogate house, AKA a barracks, and limiting their freedom. Reputable agencies overseas will send a social worker to visit each surrogate every few weeks to make sure that she has what she needs. Being so far removed from the pregnancy may be a little unnerving, but don't worry. You have taken a great effort to ensure that your surrogate is experienced and responsible, right? Your agent is going to manage all of the expenses and the legal tasks related to the surrogacy, and you get to follow along with personal telephone calls and video chats. The surrogate will attend regular prenatal exams and ultrasounds, and there are often more prenatal visits during a surrogacy pregnancy than even a typical natural pregnancy. And throughout the pregnancy, the intended parent's primary obligation is to support the surrogate. Right? That usually means keeping your escrow account funded so she gets her monthly living expenses, and making sure that medical care is always available. Now that said, many intended parents want to feel more involved and connected to the pregnancy, which is great, right? There are several opportunities. The parents may decide to be personally involved and physically present at some of the major milestones, right? At least at the surrogate's approval, of course. Major milestones during your surrogate pregnancy. Once the pregnancy has been established, there are a number of milestones, a number of events that the intended parents should celebrate. The parents' involvement can help form an important attachment to the baby and make the transition to being a parent more successful, right? And you can celebrate these events with the surrogate herself. For example, the first ultrasound. A transvaginal ultrasound or a sonogram is performed anywhere from 6 to 8 weeks after the transfer. And the first ultrasound will show the gestational sac and possibly even the early detection of your baby's heartbeat. The first ultrasound is your first chance to actually see and hear your growing baby. It's a momentous occasion for many parents, and some parents may ask to attend in person. But if not, there will be scheduled ultrasounds about every month or so in most cases. And every ultrasound is a chance to hear the baby's heartbeat, to view photos of the developing fetus, and to watch videos of the baby. Digital copies of those results will be sent, but you can ask to attend in person. The end of the first trimester, right? The first trimester is the most fragile when 80% of miscarriages happen. Many couples won't even announce the pregnancy until this fragile stage has passed. And when the first trimester ends, the baby has made it through the most developmental milestones, right? And now is the time when most parents take a deep breath. They share the happy news with their friends and family, and they celebrate. Learning the gender, right? If you're dying to know whether to paint the nursery pink or blue, you can usually learn the baby's gender around week 14. Doctors can usually determine the baby's sex during a routine ultrasound visit around this time, but not always. For obvious reasons, it's easier to demonstrate in an ultrasound image if the baby is a boy. Girls may need to wait a little bit longer before knowing with 100% certainty. Gender reveal parties are a popular way to celebrate this milestone, but even a small celebration between the parents and the surrogate is warranted, and you can whittle down your list of baby names by 50%. If your ultrasound hasn't revealed a gender, a chromosomal test will give you a definitive answer, and a NIP test or other second trimester exams are a good opportunity to celebrate. The non-invasive prenatal test, or NIPT, NIPT test, is a highly sensitive test that screens for Down syndrome and certain other possible abnormalities, This test will be done around week 14 at the start of the second trimester. The test will also detect the gender of the baby. And when the test comes back clean, the parents can take a deep sigh of relief that the baby is healthy. And the NIPT test will detect an increased risk of Down syndrome with 99% accuracy. But it's still a screening test rather than a diagnostic test. So this means it can only tell you whether there is an increased risk of having a baby with an abnormality rather than give you a definitive diagnosis, So other exams that may be included, nuchal translucency screening or a quadruple or triple marker screening. They also screen for chromosomal problems. If any of these tests show an increased risk, then you'll want to follow up with a diagnostic test, such as CVS or amniocentesis. A 20-week ultrasound marks the halfway point of the pregnancy, and congratulations are definitely due. It's challenging for many parents to watch their pregnancy from the sidelines, The surrogate gets to feel the baby grow, kick, and become more real. This is a classic case of no news is good news, but parents still get anxious for news and updates. So the 20-week halfway milestone is a great reason to celebrate. 3D and 4D ultrasounds can create a three-dimensional image of your baby. They're not standard prenatal tests, but some clinics can perform them at the request of the parents, and they let you see the baby's face for the first time. All ultrasounds use sound waves to create an image of your baby in the womb, but 3D ultrasounds create a three-dimensional image of your baby, and 4D ultrasounds create a moving video. Some doctors like 3D and 4D ultrasounds because they can show certain birth defects, like a cleft palate that might not show up on a standard ultrasound. Studies show that 3D and 4D ultrasounds are safe when done in a clinic environment, but that said, experts caution against using external commercial services that may not have the best level of training. In the US, it's common for intended parents to be very involved in the pregnancy. And at a minimum, the parents will want regular updates throughout the pregnancy. But anything beyond that should be discussed and agreed early in the relationship with your surrogate. If the parents expect to be heavily involved and the surrogate enjoys her privacy, well, then that may not be a good match. You should decide how much involvement is appropriate before signing the surrogacy contract, It's important that the surrogate and the parents mutually agree on how much contact the parents are going to have. And then it's important for the intended parents to respect that agreement and give the surrogate her privacy. Consider the following common requests from intended parents, These should be discussed between the surrogate and the parents to set the level of their involvement early in the matching process. Will they attend regular prenatal exams? Will the parents be able to have personal visits to the surrogate's home? Will the parents be present in the delivery room at the birth, and will they be able to bring a camera or video recorder? Some surrogates and intended parents expect an ongoing relationship. If agreed, they may maintain contact long after the baby is born, but only if they agree. Remember that the surrogate is neither a servant nor an employee, She is a partner in the surrogacy journey. And so she's entitled to her privacy and autonomy, We advise all parents to read about your surrogate and building a relationship with her in the surrogacy guide. Now, you can watch the next video in this series on the delivery and the process of bonding with the baby. There are also other videos on a variety of topics related to your surrogacy journey. And of course, you can always find information in the surrogacy guide at sensiblesurrogacy.com. Or you can send us a note to ask a question from one of our consultants. Either way, we're available to guide you through your surrogacy journey. Just let us know how we can help.